There's really good evidence that stress increases arrhythmias. Basically, stress releases a few different hormones. One is cortisol, the one is norepinephrine, and another one is epinephrine. And these all increase the risk of arrhythmias. Stress is typically results in more sympathetic stimulation and less parasympathetic stimulation. Stress leads to a higher heart rate, abnormal repolarization, and it increases the contractile force. It also leads to increased risk of PVCs, which is premature ventricular contractions, and it decreases the parasympathetic stimulation, which is mediated here from the vagus nerve. This is the rest and digest nerve of the heart. Heart rate variability measures how much stress you're in. Are you more in sympathetic or are you more in parasympathetic? So low HRV is generally going to be less than 30 milliseconds and high HRV greater than like 70 milliseconds. And you can measure these in a variety of devices. Some of you have Oura rings, some of you have smartwatches, but also this app Weltery will measure your HRV. What can you do to improve the stress? I want to summarize some studies, what you can do and how strong the evidence is. People that are having stress at work, AFib risk increased by almost 100%. So this was the job strain study published in the Journal of the American Heart Association. In a yoga randomized study, people were put in 12 weeks of yoga and it decreased their atrial fibrillation episodes by about 45%. Anger was predictive of going into ventricular arrhythmias, increased by 30-fold if you're angry for 30 minutes. People who did cognitive behavioral therapy for 8 to 9 weeks and stress reduction, they were able to decrease their AFib-related anxiety and improve their quality of life. And this is done on 104 patients. Another thing you can do is regular aerobic exercise. So that increases the HRV and it decreases the AFib symptom score. In the past, we've talked about sleep. Sleep is another way to reduce your chronic stress. And in this study, they found that there's 35 less recurrence since atrial fibrillation after an ablation if you get good sleep hygiene. And then again, stress at work, you can reduce your risk of atrial fibrillation by just controlling and adjusting to stress at work. Let me just share a few more tips as to how you can reduce your stress. One is deep breathing. Inhale for 4 seconds, hold it for 7 seconds, and exhale for 8 seconds. Even if you just do this 5 minutes twice a day, that will increase your parasympathetic response. A short 10-minute walk after a meeting can also, exercise is very potent. This is just another type of meditation. This is talking about reducing stress from work. Reducing your screen time 60 minutes before bed can hopefully help you get better sleep. And laugh therapy is another type of deep breathing stress reduction exercise. There's something called laugh breathing, and that's basically where you inhale in 3 seconds while smiling, and then you exhale for 6 seconds while laughing. You didn't even hear a joke, but you're laughing, and that actually lowers the stress hormones.